Starting tomorrow, the Ford government will discontinue health coverage for those without an OHIP card.
The card hasn't been required throughout much of the pandemic, and as Mike Lang reports, healthcare providers in the region strongly disagree with the change, fearing the worst for vulnerable populations.
So I think it's completely unreasonable to ask physicians to subsidize the health care of people in this province.
Dryden physician Stephen Viheryoki's concern could become a reality. He says that many of those who don't have OHIP cards either live in remote communities, are part of vulnerable populations, or are non-Ontario residents. With the province cutting off coverage to those people, Viheryoki fears that the only way they can receive the care they need is if healthcare practitioners provide it on their own accord.
Relying on the goodwill of physicians who feel they need to provide care is inappropriate, and really the province should step up here.
In more populated areas like Thunder Bay, health centers must accommodate an even greater volume of impoverished patients. Norwest CEO Juanita Lawson says it's not easy for those in unstable living conditions to apply for and hold on to a health card.
Those are things that I think many of us take for granted, but those are also things that many individuals struggle with obtaining, even though we think that accessing health care is fairly simple. It's not for many people.
Registered midwife Rebecca Hautala says it will cause those patients to further delay treatment, leading to worse health outcomes.
Not having comprehensive health care for everybody is just really not equitable, and it's not okay. They suffer because of the long-term outcomes of not receiving care early enough that we can actually provide interventions to improve their health care, and their overall health in general is going to just cost the person, the community and society and the healthcare system more money eventually.
We would want some reconsideration with regards to this decision and some time for communities to be prepared to take a look at where uninsured funding can be placed, to look at expanding team care models to again support people who need this care.
The policy to provide health care only to those insured with an OHIP card takes effect on Saturday. Mike Lang, TBT News.